While since we've had any of these meetings on the COVID processes that we have here at Genesee County. It's been nice that we've had numbers that have been down that has resulted in increased freedoms from worry, but unfortunately this pandemic is not over. The Delta variant is confirmed in Genesee County. This variant is significantly more contagious than previous SARS-CoV-2 viruses. To talk about what needs to be done going forward, we have Genesee County Health Officer, Dr. Pamela Hacker. Dr. Hacker.
Thank you, Commissioner. I think I'm going to have to take this off. I am fully vaccinated, so you can hear me. Thank you all for coming on such short notice, and I'd like to say that today I'm announcing the Medical Health Officer Indoor Masking Directive. In order to respond to the increasing case counts that we're seeing in Genesee County and throughout Michigan from the increased threat of the Delta variant. To distinguish this from a health officer order, an order is reactive and will be used in situations if it's necessary to respond to a known case or an ongoing transmission. This directive is proactive in order to give the community information as to best how to respond to this deadly virus. We know SARS-CoV-2 spreads from person to person, primarily through the inhalation of air, carrying very small droplets and aerosolized particles. The risk of transmission is greatest within 6 feet of an infectious person, but can also occur more than 6 feet away. Fully vaccinated people have a very high level of protection even against the Delta variant. Compared to that, unvaccinated people have a much higher rate and a more higher rate of getting severely sick or dying. Until the Delta variant, fully vaccinated people who had a breakthrough case did not have a high enough viral load in their respiratory system to spread this infection to others. But Delta COVID-19 infections do spread from person to person who are symptom-free, and with this particular variant, it is known now that they can infect others up to 3 days before symptoms appear. It is circulating now in Genesee County, and in the state of Michigan, it accounts for more than 90% of new infections. It's significantly more contagious, and relaxing of the masking restrictions were based on evidence from earlier SARS-CoV-2 viruses. Case counts have been steadily increasing in Genesee County during the past month. Our risk level was at A, on a scale of A through E at the state, on July 1st, and now it is, as of July 30th, it has increased to a level of C. If you want to look at this, go on the Michigan Safe Start map data, and in the banner on the top, it will have a conversion from our Michigan Safe Start A through E levels to the CDC way that they're now monitoring it with low, moderate, substantial, or high risk of infection. So with this, I have determined that controls are necessary to reduce transmission of COVID-19 and protect the public's health based on the following facts. Currently, some 46.2% of Genesee County residents aged 12 and older are fully vaccinated against COVID-19. So that is approximately 246,000 residents who remain unvaccinated. About 190,000 residents are eligible for vaccination and are not yet vaccinated. There are about 56,000 children in Genesee County who are less than 12 years old. These children are not currently eligible to be vaccinated and are at high risk for infection. Additionally, we have tens of thousands of people here in Genesee County with underlying health problems. These individuals are at increased risk of severe disease or death from COVID-19 due to the Delta variant compared with the previously circulating SARS-CoV-2 lineages. The vast majority of COVID cases, hospitalizations, and death do occur among unvaccinated people. Vaccination affords excellent protection against severe COVID infection, but a small proportion of vaccinated people will still become infected, and then with the Delta variant, they now can serve as a reservoir of transmitting the Delta variant. Pardon me.